Welcome. Today we are going to talk about dementia and social prescribing. So let me introduce myself first. My name is Angel Anjali and founder of this platform, and Dr. Kuljit is here already. And my background is women's health movement coach as well as nutrition counselor, and I'm a guest who is going to be talking. I'm going to go live with, I'm going to send. Hello, Dr. Kuljit, welcome.
Thank you, Ange. Good morning.
Good morning. Thank you for being here. Thank you, everybody, for being here. And if you can hear us, give us a thumbs up so we can, continue with sometimes, the technical glitches. So anyway, welcome. Thank you so much for being here. And I have already done my introduction. So tell us about yourself.
Yeah, sure. So, Ange, I'm Dr. Kuljit Singh. I'm a GP here on the Gold Coast. I've been practicing for over 2 decades now. More recently, I've become the clinical director for KNG projects, KNG Healthcare. And then I've also been honoured to be the national chair for our college, Royal Australian College of General Practitioners, for social prescribing,
Yes.
and also for ASPIRE, which is the Australian Society of Institution of Social Prescribing Research and Education as well. It's a long word, so just get that mixed
Yes.
up. Aspire is much easier. There we go.
Yes. No,
Yep.
because I was going to read your bio. I'm like,
Yep.
oh my God, she has so much to say, and I would give it to her because I didn't want to, the read it with the mistake and things like that. But anyway, thank you so much. It's an honor to have you here, and
Thank you.
because your schedule and the children and everything else. So thank you so much. And so before we start this conversation, I would like to say that this talk is all about to bring awareness and not a specific advice or medical advice for anybody. So if you need help around dementia and social prescribing, reach out to your health practitioner, or you can always reach out to Dr. Kuljit. And yes, so would you like to add anything in that?
Yeah, no, I agree. I think it's very important to take this information just as general information and
Yes.
always seek your GP or health professional's advice. It's not an individualized advice that we're giving today. So, yeah,
No,
just
we
general.
we are
Yep.
just bringing the awareness
Yep.
around as dementia is growing issue, and how it is correlated to social prescribing or prescription.
Yeah, either way. So social
Yes.
prescribing, the verb, or social
Yes.
prescription. Yep, the noun. So yeah, that's
Okay.
it.
Yes. Thank you. All right. So let's go with the first one. So very basic question is what is social prescribing and how does it work in a GP setting?
Yeah, sure. Okay, so just a very general description or definition. It's basically a preventative, non-clinical tool where we try to connect patients or residents, consumers back into community assets or resources in group settings. That's the ideal thing. So that's the key
Yes.
word. No more solo. We want to do things together.
Yes. Yeah.
And it's to improve the well-being of the individual, but also the community at large.
Yes,
Yeah.
yeah. So that is what you are creating at the hospital,
Yes.
right? That
Yes.
beautiful space, and like I was, lucky to be able to volunteer with the, elderly, mm, the people, and it was beautiful moment. So thank you so much for the opportunity,
No,
and
thanks for
so
coming.
it was interactive, and as well as the things that they wouldn't normally do, I guess, is it?
Yes, absolutely, absolutely. And I guess, look, that's that cohort, our older senior population, that often does suffer from social isolation and loneliness.
Mm,
And then if you add to that, dementia, that just
mm.
increases it even further. So, they're very, very much a vulnerable group, and we really need to be much more aware of connecting them back into community and, different groups, different organizations and things. And that really helps them in terms of their physical health, their mental health, their social health as well.
Yes,
Yep.
absolutely. And I feel like you just started talking to me about this last year and you are doing it.
Yes.
You are going full on. So
Yep.
that's yeah, my kudos to you.
Thank you. Thank
So,
you.
yeah, so how can social prescribing support women living with dementia and their caregivers beyond traditional medical treatment?
Yeah, yeah. So look, I guess firstly with dementia in general, there's no medication as such that will cure the condition. It will halt the progression of it and maybe give some symptom relief. But we definitely need the holistic approach with it in particular for the patient who's suffering from dementia, for their family, for their carers and their immediate friends and their network as well. Because it is a condition that often will last for so long, it might be 5 years, it might be 10 years. And different stages of the condition have got different symptoms and different degrees of severity as well. So it can be a very taxing condition, physically and mentally for everybody. And I think that's the key that, often you just, days roll into weeks, into months, into years, and often you don't have that social connection. So it's again something we need to make sure we're encouraging carer and patient, that you need to ensure you are socializing, you've got a tribe or a village or a community around you, and you're doing regular activities that you actually enjoy in that group setting. Because by filling your own cup, you're able to fill that of others as well, right? So if you're looking after yourself, you can look after others better too. And as I said, the options with social prescription, there's 5 different categories that we can get involved in, like physical activities, nature-based activities, art and craft activities, culture and heritage, and education. So, there's a broad spectrum and it just depends on what the individual likes or prefers and enjoys. But I think as health professionals, we need to make sure that we are suggesting it to the patient and their carers on a regular basis, and we are looking after that carer as well as the patient. Very, very often we neglect them or we forget about them, and it's important. And this is just an additional tool that we can give them, that apart from medication, that's not the only answer. Just by doing something that takes you away from that constant stress that you're dealing with, it gives you relief, and doing it in a group setting is always very, very beneficial.
Yeah, and then you get to fill your cup up as well,
Yes,
right?
yes,
And then
absolutely.
different people, they coming together in a community and they all bring something else in your,
Yep.
and the thing that you might have been struggling with, they might
Yes.
give advice or support or suggestion as well,
Yes.
right?
Yeah. Well, they can share stories too. So,
Yes,
often
absolutely.
people might be thinking, I'm going through this alone. But when you start sharing stories in a group setting and you sort of go, well, actually, there are other people that are also suffering from this. And, I'm not alone. And I
Yes,
think that's the theme this year, isn't it, Ange? I mean, they're saying nobody can do it alone. That's the theme
yes.
of Dementia Awareness Week. And that is so, so true. I think you get that motivation and you get that peer-to-peer support when you're doing things in a group setting, and outcomes are much better if you support each other and motivate each other.
Yeah,
Yep.
absolutely. That's
Yeah.
yeah. So it gives you the little bit more power towards how to stay positive and be able to support your relative who is going through dementia as well
Yes.
as yourself as well.
Absolutely, absolutely.
Yeah.
Because as I said, it really does just draw out all your energy physically, mentally, emotionally as well. So you need to just keep recharging your battery, as often as you can. And I would say on a daily basis, it needs to be done for short little periods of time. And then on a longer, every week at least, I think, as often as you can do it, you should be connecting back in with people. Yeah.
Yes. So you live by example because this morning, you shared with me the sunrise, just looking at the sunrise, right? And the
Yes.
deep breaths, having a cup of tea or coffee
Yes.
outside,
Yes.
looking at what makes you feel, calm and, centered and grounded, and doing those
Yes.
little things is those are the little examples that you can,
Absolutely.
do that.
Yep, yep. So that's one of the buzzwords is mindfulness, right? So
Yes.
just having those mindful moments every day, whether it's at the beginning of your day or at the end of your day. For me, sunrise and sunset are beautiful times to do things. Some people like to reflect with gratitude, journals, those sort of things. Whatever works for you. But I think sharing it with a group again and
Yes.
motivating each other to do that. These little lifestyle changes that can really improve, our health outcomes as well. Yep.
Yeah, yeah, absolutely. So from your experience, what lifestyle or community-based interventions could help reduce dementia? risk among women, especially in midlife.
Yeah.
Dementia anyone can have dementia, but,
Yep.
because our platform is women's health, so
Yes.
saying women's health, but
Yes.
in general.
Yeah, yeah. Well, look, Ange, as you probably know, dementia does hit women more than men.
Yes.
And so it is the leading cause of death actually in Australia for women, unfortunately. So if we talk about risk factors for dementia, we've actually come up with about 14 risk factors now. And so I might just list those for you just very quickly. So we know that education level is one risk factor. So the more educated you are, the less chance you have of developing dementia later on. So that's why it's really important we educate our children, etc., as well as we can. Having had any sort of trauma to the head or brain injury increases our risk as well. When we come particularly to women or middle age sort of things like the typical risk factors we know about, so smoking, alcohol, obesity, physical activity or inactivity, air pollution, diabetes, cholesterol, blood pressure, depression, social isolation, all of those sort of things that are very common risk factors for, heart disease, cardiovascular disease, heart attack and stroke. They're also risk factors for dementia. So, I think if we as women at this age, when we're going through perimenopause or menopause, that is something that we need to watch, because that protective factor of estrogen starts declining. That can increase our risk of dementia as well. So it's important to look at the modifiable risk factors, like, as I said, sugar, cholesterol, blood pressure, your weight, level of activity, and all those other toxins and things we're talking about. And if we can minimize those, then I think we're putting ourselves in good stead to hopefully keep dementia away. So,
Yeah, that's amazing. Thank you. And how can social prescribing be used to support women experiencing isolation, anxiety, or stress while managing long-term health conditions?
Yeah. So I guess, look, the first thing is if women have got long-term health conditions, let's just take, for example, diabetes. So we know that affects so many different factors, but it's a long-term condition. So again, having that support with a group for the long run is actually very beneficial. There have been studies to prove that when women are trying to lose weight, improve their diet, drop their blood pressure when they've got diabetes, they do it much more effectively when they're doing it in a group setting. So even 6 to 8 women, 6 to 8 people together, getting together on a weekly basis to discuss the topics to do with diabetes, as I said, whether it's activity, diet, weight, stress, whatever it might be. It just gives them that then the next level, which is that connection, which might encourage people to then go, okay, let's remind each other that we need to go for a walk once a week, or we need to make sure we're looking at what our diet habits are, or, have you actually stopped smoking, or, so you just, again, you're motivating each other. Yeah, exactly right. Exactly. And showing up and reminding people that, look, we need to be there, because we're doing it as a group thing. So it's not just you yourself where you can let yourself down. You're actually doing it. You're going to hold it to the group as well. So, yeah.
And the activities doesn't have to be like very extreme one, right?
No, not at all. Not at all.
Yeah. So the 3 of us girls, a few days ago, we went to the bowling, the time zone.
Yes.
And we
perfect.
Went crazy.
So good.
Like
Yep, absolutely.
My daughter always takes me there, pushes me to, Mom, come on, let's do this. And we play all these weird and wonderful games.
Yes.
And then I said to girls, you know what, we're going there. And they were like, okay, we have never done that. But then it was empty, and we did everything, like just becoming like a little, kids again.
Yeah.
Just let our hair down and
good.
Not worrying about anything,
Yes.
And it was just, before we started, I was just heavy head, and, after Expo, I was still feeling that. And then after that, I was recharged and I was ready to go. And so, it's the little example. Like,
Absolutely. Yeah. And it does, like you said, it doesn't take much. It could be any activity whatsoever.
yes,
Whatever gives you a bit of fun, a bit of joy. It gives you
yes,
the ability to communicate with some like-minded people or friends, have a bit of a laugh. But, you know, if you can do something which is maybe physically active, you know,
yes,
or increasing your knowledge, whatever it may be, or getting some nature time. So, but realistically, anything is better than nothing. And I think, you know, doing it in a group setting on a regular basis is therapeutic. So we just need to connect more.
yes. And us women, we love talking, right? We love
Yes,
talking.
yes, we
But
do.
yeah, but saying that, you know, it is always great when you can have that, you know, not the toxic side of it. Sometimes it can
Absolutely.
go that way, but
Yeah.
if you can lead, you know, like,
Yes,
hang on, we are not here, but that depletes, right?
it
But if
does.
you can lead with the
Yep.
happiness or excitement
That's
or
right.
fun, and, you know,
Yep.
just
Yep.
forget about everything else, and then let's recharge our mind and
Absolutely.
body.
Yep,
Yes,
yep. And that's mindset, isn't it? Again. So, you know,
yes,
having a positive mindset, just making sure there's no room for negativity, there's no room for gossip. You know, it's all about having a positive experience for everybody, no time to waste, you know.
yes.
That's really important.
Yeah, because I guess we do lots of, well, I bring lots of women, you know, together to for
Yes,
the network, but at the same time, you know, we can share our issues,
yes,
but
yes,
what can we, how can we solve it? The solution, positive solution, instead of, oh, you poor thing, oh,
yeah.
that's horrible. And then
No,
when that happens and it depletes everybody's energy, but
yes,
instead, okay, maybe we can do this, and everyone
yes,
can come up with the
yes.
ideas, and
Yep,
or maybe, you know, if you're feeling this way, maybe we should go for a walk together, you know,
exactly.
like,
Yep, yep.
yeah, I think
Yep.
little things like that. I went on rant on that, but
No,
sorry.
no, no, that's right. But no, you're right, because that actually that there is a thing called transference. So, you know, we talk about being able to transfer, you know, that negative energy gets transferred
Yes,
over. So if you're being very negative or you've got a depressed demeanor and manner and mood, that can pass on to the other person. So you
yes.
do need to protect that little, you know, that little bubble of yours as well. So it is
Yes,
important. Yeah.
because I have seen, you know, sometimes it can turn into a very toxic
Yes.
environment in that
Yes.
little group, and it
Yes.
doesn't help anybody.
No.
So
No.
I've always been aware that
Yep.
this has to have some sort of solution, or some sort
Yes.
of, okay, what are we going to do with this, you
Yep.
know,
Yep.
instead of just dwelling on it and then,
Yes, definitely.
yes.
Boundaries, have boundaries. Very important.
Yes,
Yep.
yeah, I'm learning on that. I'm getting better at it.
Yep.
So yeah, all right. Before we finish,
Yes.
if anyone has any question, please pop in the comment section. And while we wait for the question, please let us know, where can we find your amazing work?
Mine.
Yes.
So I've got a LinkedIn account, so that's pretty much where I'll be sharing, you know, any of my professional encounters, any of my keynote speeches, conference workshops, things like that. Um, I've got my Instagram account too, but that's probably not sharing as much of my professional side. But yeah, people could just reach out, you know, and just connect with me if they've got any questions. And yeah, we can definitely answer those.
Yeah,
No problem
I'll
at all.
put it in the I'll put all the information in the comment section as well.
Yep.
God, I can't find the word, in the content. In
Yes.
the
Yep.
content, I got the word. Yes, in the content section. So,
Yep.
all right. So there's no question. So thank you so much, everyone, for being here. And before we go, any final words, Dr. Kuljit?
No, I think just remember this year's theme. So nobody can do it alone. Let's help each other out. And don't be scared of dementia. You know, a lot of people are finding they
Yes.
don't have the education or awareness. Everyone is still a human being. At the end of the day, they still require all the same, you know, things that anyone who doesn't have dementia, you know, requires. So I think if we can support them, if we can have a conversation with them, if we can do an activity with them, just reach out. You know, don't be scared, because I think it's just going to increase in the next 30 years. The number of dementia sufferers is going to double potentially. I think we all need to get behind the cause and learn to connect and support better as well. Yeah.
Yes, and
Yeah.
learn about it so we can prevent, as well
Yes.
as, you know,
Absolutely.
support the people who are
Absolutely.
going through it,
Yes.
and yeah, support ourselves.
Yes. Very
Mainly,
important. Yep.
if we
We
are
don't want
taking
it.
care of the people, right?
Yes. Exactly right. Exactly right. That's
So,
it.
all right. Thank you so much for being here again.
No
And
worries. Thank you
yes,
for having me, Ange.
I cannot. Thank you so much. I
No
cannot
worries.
wait to hear all about your amazing excitement journey coming ahead.
Thank
And
you.
thank you. You,
Cool.
everybody, have an amazing day. And thank you,
Yes.
Dr. Kuljit, again.
No worries. Have a beautiful day. Bye.
Yeah. Bye.
Bye.